Children often complain of stomach pain. It is one of the most common reasons parents take children to their doctor or the hospital emergency department. Well, the differential diagnosis of abdominal pain is vast and determining when emergent intervention is essential. Firstly, you should know what abdominal pain feels like. It could be gnawing pain near the top of your abdomen, cramping pain in your lower abdomen, sharp shooting pains in many areas. Secondly, you should be aware of all such aggravating factors which makes abdominal pain worse in children. So these factors include intake of food, intake of medication, movement, change in position. Then you should be aware of those factors which are helpful in relieving abdominal pain. These includes intake of food, intake of medications, passing gas, burping. Now there are 5 important questions that you need to ask your patient before making a diagnosis. You will ask the child or the parent what symptoms child is experiencing, including headache, coughing, vomiting, weight loss, constipation, blood in urine, attention-seeking behavior, changes in bowel habits, color of stool, flank pain, painful urination, blood in stool, joints pain. You will ask parent if their home has lead-based paints, and have they seen their child eating paint chips. You will ask the patient if their child is taking any medications. Next, you will ask the parent if child or anyone in their family has had any of these conditions, like recent stomach bug, sickle cell disease, mumps, or strep throat. Now you have to examine the patient. Well, this physical examination includes checking temperature, blood pressure, pulse, checking child's abdomen with stethoscope, pushing child's abdomen, listening to child's abdomen, weight, testing child's stool for blood, thorough skin examination, tests of child's hip joint for pain. You may do blood tests including blood count, blood chemistry, and liver function tests. Now, what can cause abdominal pain in children, and what is typical for each cause? Well, there are different causes of abdominal pain in children that you should be clear about. Firstly, if the patient shows symptoms like nausea, vomiting, diarrhea, slight fever, cramping, and muscle aches, then this might give you an indication that patient has gastroenteritis. Well, gastroenteritis is infection of stomach, but if your patient has typical symptoms like pain in lower right part of abdomen and low-grade fever, then this might be an indication to appendicitis. Well, appendicitis is infection of appendix. And what if your patient is having fever, enlarged glands, and redness in throat? Then these symptoms might be caused by pharyngitis, which is in fact a condition of sore throat. And if the abdominal pain is accompanied by bloating and cramping pain, then lactose intolerance might be a reason to this. Well, this is reaction to lactose, which is a sugar found in milk. Now, if the patient shows symptoms like attention-seeking behavior, cramping pain, diarrhea, constipation, and minimal pain, then this might be due to unclear cause, as he is having alternating diarrhea and constipation. Now, if the child shows symptoms like crying spells, which usually resolves on its own by age of 4 months, then this might give you an indication that patient has colic issues, as he has crying spells due to abdominal pain. Now, if the patient has diffuse pain, then this might give you an indication that child has constipation or difficulty passing stools. Now, if the child shows symptoms like fever and cough, then this might give you an indication that patient has pneumonia. Well, pneumonia is lung infection which leads to abdominal pain. But what if your patient is having swollen cheeks and fever? Then these symptoms might be caused by mumps, which is in fact a condition of infection that causes areas around cheeks to swell. Now, if your patient is having severe pain in abdomen and joints, sweating, and sometimes fever, well, this might be caused by sickle cell anemia, which is a condition of painful crisis caused by mishap in red blood cells. Now, if your patient is having diffuse abdominal pain, which in long term causes mental retardation. Then these symptoms might be caused by lead poisoning caused by exposure to lead. Well, if your patient is experiencing worms and eggs in stool, mild pain, weight loss, and diarrhea, then these symptoms might be caused by worms. The infection might be caused by Ascaris, hookworm, and Taenia species. What if your patient is having nausea and vomiting, sometimes constipation, distended belly, and extreme discomfort? Then these symptoms might be caused by bowel obstruction, which is a state of blockage in the intestines. Now, if the patient shows symptoms like slight fever, sudden acute pain, vomiting, and decreased bowel movements, then this might give you an indication that patient has intussusception. Well, this is the telescoping of tubes of intestine into one another. Now, if the patient shows symptoms like burning upper abdominal pain, that is worse when lying down, which is relieved by antacids, but worsened by taking ibuprofen, then this might give you an indication that patient has ulcer. Well, ulcer means severe irritation of the stomach lining. Now, if the child shows symptoms like joint pain, vomiting, distended belly, and sometimes bruising, then this might give you an indication that patient has Henoch-Schönlein purpura. Well, this is inflammation of blood vessels, which often follows respiratory infections. Now, if the patient shows symptoms like severity of pain varies, but generally over the flank, then this might give you an indication that patient has kidney diseases. Well, these are congenital kidney diseases. Now, if the child shows symptoms like weakness, fatigue, upper abdominal pain, and jaundice, then this might give you an indication that child has hepatitis, which is defined as inflammation of liver, but it's unlikely to occur in children. If the child shows symptoms like fever, right upper abdominal pain, sometimes pain in right shoulder, nausea, vomiting, chills, and sometimes jaundice, then the disease could be cholecystitis, which means the presence of gallstones, and it's unlikely to occur in children. If the child shows symptoms like pain in the upper abdomen, sometimes in back, nausea, vomiting, and rapid heart rate, then this might give you an indication that patient has pancreatitis, which is unlikely to occur in children. Well, pancreatitis is the inflammation of pancreas. Now, if the patient has low-grade fever and pain in lower abdomen that is relieved by defecation of stool that are soft, then this might give you an indication that patient has Crohn's disease, which is unlikely to occur in children. Well, Crohn's disease is defined as inflammation of entire gastrointestinal system. And lastly, if the patient shows symptoms like low-grade fever, pain in lower abdomen, blood may appear in stool, which are not well formed, and sometimes weight loss, then this might give you an indication that patient has ulcerative colitis, which is also unlikely to occur in children. So, ulcerative colitis is the inflammation of rectum and colon. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of abdominal pain in children. If you want to learn about the differential diagnosis in adults, you can watch that too, only on sqadia.com.